Hi, my name's Dr. Shri Datta and I'm a consultant obstetrician and gynaecologist in London. I'm also an ambassador for the British Medical Association Research Foundation. Over the next few minutes, I'd like to talk about what an abnormal smear is and what we can do about it. So firstly, just to talk about the cervical screening programme, you'll be invited to have a cervical smear every 3 years from the age of 25 until the age of 50. And the screening programme actually goes up to the age of 64, but from the age of 50, you'll be invited every 5 years. Now, smears are a great way of detecting changes on the cells of your cervix before they become cancer. And there's a whole range of things that we can actually find on smears. They range from simple infections right through to mild, moderate or severe changes, which all occur before becoming cancer. If you get an abnormal smear result, it's really important that you do go and see your doctor, because for some patients, the changes may develop into cancer sooner rather than later. But what happens when you actually find an abnormal smear result? Well, your GP tends to write to you to tell you exactly what the smear test result says. And generally speaking, these can vary from an infection with a common virus known as a human papillomavirus right up to significant changes on your cervix. And the term that might be used is dyskaryosis. That's the term that the lab uses to describe the changes on your cervix. And there are different types of changes that can occur. They can range from mild changes on one side of the spectrum right through to significant severe changes. So what happens when you get the result from your GP? Well, your GP will refer you to a specialist clinic called a colposcopy clinic, generally situated within a hospital. You'll be seen by a specialist and we will ask you a certain number of questions, including whether you smoke or not, if you've got any abnormal symptoms such as bleeding in between your periods, or in fact bleeding after intercourse. We'll also review the type of contraception you're using, if you are using any, and any medical problems that you have. After that, we'll invite you to a specialist examination, which involves a colposcope to look at your cervix in greater detail. Essentially, it's really like using a microscope to highlight any changes on the neck of your womb. And we do this by using 2 different solutions to highlight the changes on your cervix. Once we've done that, then we can identify whether the changes that we're seeing using the colposcope really correlates with the smear changes that have been found. If we're worried at this point, we can also take a pinch of tissue, which is called a biopsy, and that can be done at the same time. In some cases, we may need to consider local anaesthetic, but this isn't always necessarily the case. The benefit of taking a biopsy is that we can send further tissue to the lab for analysis to check that the results are really accurate. And it's really once we've got this information that we'll consider whether you need any next steps or not. Once we've taken the biopsy, we'll make sure that we stop any droplets of blood and any bleeding that can happen at the same time. And our advice would be to make sure that you avoid sex, swimming or using tampons for a couple of days at least after the biopsy's been taken. It's not unusual to experience some cramp-like sensations, so you may need to take some painkillers if we take a biopsy. It takes some time to get the biopsy results, and we marry these up with the test results that we've got from your GP smear, as well as the examination findings at colposcopy. And once we've got that full picture, then we can make a decision as to whether you need any further treatment. In most cases, you don't actually need treatment. We monitor the situation and check you in 6 to 12 months' time to make sure there are no further changes on the neck of your womb. So that could be a simple colposcopy examination back in our clinic with another smear. Alternatively, if the changes are significant, we can actually treat them again in clinic. So this would be done under local anaesthetic in most circumstances. And the benefit of treatment is that we can remove the abnormal area on your cervix, which has got changes in the cells. You might ask, why don't we perform this on all abnormal smears? Well, there are risks attached to actually removing part of your cervix, which is the treatment for abnormal cells. And that can include a slightly higher risk of preterm labour in subsequent pregnancies. So we have to weigh up the benefits and the risks. And this is a discussion that you will have with your doctor if you need to, based on your results. If you have to undergo treatment for abnormalities on your cervix, we'll write to you and contact you with the results. We'll also make sure that we follow you up in about 6 to 12 months' time to make sure that no further abnormal changes have happened. So just to recap, today we've looked at the cervical screening programme, we've looked at what an abnormal smear means, and of course what we can do about it. My name's Dr. Sri Datta, and I hope this has been helpful.